Hello viewers, today we'll be talking about pharmacy informatics, enabling safe and efficacious medication use by Adushoke Loveth, University of Bello Teaching Hospital, Department of Pharmacy. Today we'll be discussing on the medication use process, pharmacy informatics, order entry, order verification, dispensing, administration, monitoring, and the future of informatics in healthcare system. At the end of this presentation, we should be able to list the activities that occur at each step of the medication use process. We should be able to define pharmacy informatics and other core informatics terms, discuss the role of pharmacy at each step of the medication use process, describe challenges with implementing computerized provider order entry, describe the components of an electronic prescribing system, and explain the importance of interoperability to the future of healthcare system. Healthcare practitioners of today have a multitude of responsibility within their scope of practice. For pharmacists, whether verification and filling prescription, compounding medication, advising patients of proper medication use, or collaborating with other practitioners in the care of patients, the core responsibility lies on the safe and effective use of medication therapy. Clinicians aim to minimize patient safety. Clinicians aim to maximize patient safety while minimizing medication misadversion, such as medication error and adverse drug events. Medication use process. The medication use process is a system of interconnected parts that works together to achieve the common goal of safe and effective medication therapy. The interconnected parts include the people, system, procedure, and policies that manage medications and related information in patient care. The medication use process is cyclical in nature and begins with the prescribing stage. In this stage, the practitioner assesses whether medication therapy is warranted and if so, orders therapy accordingly. The health information tools utilized at this prescribing stage include computerized provider order entry, electronic prescribing, and clinical decision support system, including various medication references. In the order verification on transcribing stage, the order medication enters the pharmacy computer system. A pharmacist assesses the appropriateness of the order and any issues or discrepancies are addressed. Health information tools used at the order verification stage include computerized provider order entry and electronic prescribing. Various drug information references, also electronic in nature, may be used and may be built into the system. Next is the dispensing stage. Here, the medication is prepared and distributed from the pharmacy either directly to the patient or to a healthcare provider such as a nurse. There are many health information tools utilized in the dispensing stage, including the barcode verification, automated dispensing cabinets, syringe filers, total parenteral nutrition compounders, and other robotics. Next is the administration stage. In the administration stage, in which the medication is reviewed for appropriateness and then given to or taken by the patient, healthcare providers, caregivers, the patient, and the patient families may be involved in the administration stage depending on the setting. Health information tools used there may include point of care barcoding, electronic medication administration record, and intelligent infusion pumps. Next is the monitoring stage. The final stage in the medication use process is the monitoring stage. At this stage, the patient's response to the medication therapy is assessed, outcomes are documented, and interventions are made as necessary. Health information tools used here include the adverse drug event surveillance, antibiotics drug surveillance, and rule engines. What is pharmacy informatics? The term informatics simply refers to the use of computers to manage data and information. Information exists at the intersection of people, information, and technology. More specifically, pharmacy informatics focuses on the use of information systems, and automation technology to ensure safe and effective medication use. All pharmacies are affected by the electronic information system that make up pharmacy informatics in virtually every aspect of practice. For example, patients record, medication administration, and usage. The two broad categories of information used in pharmacy informatics, as well as other clinical information domains, are patient-specific information and knowledge-based information. Patient-specific information, which is created and applied to the process of caring for individual patients, include medication and medical history, laboratory test results, radiology interpretation, immunization history, physical assessment, and other information that is unique to the specific patient. Today, the information is generated and housed in healthcare facilities such as pharmacies, hospitals, and clinics. Knowledge-based information. The knowledge-based information, on the other hand, forms scientific basis of healthcare and include referential information about medications, procedures, disease states, etc. Clinical practice guidelines, as well as many other domains of health and medical knowledge. All healthcare providers make patient care decisions based on a combination of patient-specific and knowledge-based information, a process that can often be a real challenge. In the 1999 report, the Institute of Medicine estimated that 44,000 to 98,000 deaths occur each year due to medical error. A study published in 2016 by researchers at Johns Hopkins Medicine indicated that this number is likely much higher, estimating that 210,000 to 400,000 deaths occur due to medical errors among hospital patients. This makes medical errors the third leading cause of the United States beside heart disease and cancer. As such, it is imperative that pharmacists identify and prevent adverse drug events at this early stage in the medication use process. The three health information tools that can aid in doing so include computerized provider order entry, electronic prescribing, and clinical decision support system. The computerized provider order entry is the process allowing medical provider instructions to be entered electronically for the treatment of patients under a provider care. Order entered by a computerized provider order entry system are communicated to the medical staff and appropriate department over a computer network. Computerized provider order entry eliminates illegible handwriting, decreases medical error, as well as the delay in order completion, improve patient care, and is therefore an important component in healthcare information system. Challenges with computerized provider order entry implementation. Despite these clear benefits, there are barriers that must be overcome for wide adoption to be realized. In 2004, Pharm and colleagues published a report identifying and addressing these barriers. First is provider and organization resistance to change and computerized provider order entry adoption. Reasons cited for this resistance varies and include perception that paper methods are faster or more efficient and that implementation attempts will be costly and unsuccessful. The second major barrier identified is the high cost of computerized provider order entry, implementation, and lack of capital. Strategies identified to overcome high costs include realigning the hospital priorities to focus on patient safety, leveraging external influences such as published literature to increase awareness about patient safety, and measuring computerized provider order entries' impacts on hospital efficiency. The last major barrier identified was selection of a specific computerized provider order entry product from the many options available. The electronic prescribing. A more precise definition would be a prescription entered by a prescriber directly into an electronic format using agree-upon standard that is securely transmitted to the pharmacy that the patient chooses. Components of an electronic prescribing. Aside from the prescriber, short scripts, and the pharmacy, there are many other components that make up an electronic prescribing system. These components include the computer software, the hardware needed to run the software, organization that supports transmission and sharing of data, data standardization, authorization of payments, communication to the pharmacy, and the processing of prescription within the pharmacy. The electronic prescribing software should provide functionality to support accurate, efficient, and safe entry and transmission of prescription. Clinical decision support system. According to the American Medical Association, Clinical decision support is described as providing clinicians, patients, or individuals with knowledge and specific or population information, intelligently filtered or presented at appropriate times to foster better health processes, better individual patient care, and better population health. Clinical decision support system are the computer systems that provide clinical decision support. The three basic components of a clinical decision support system include a reference engine, a knowledge base, a communication mechanism. The inference engine, also known as the reasoning engine, forms the brain of the clinical decision support system, working to link patient-specific information with information in the knowledge base. It evaluates the available information and determines what to present to the users. Interoperability, interoperable electronic health record. The current healthcare system is decentralized and fragmented. Because of this, significant communication gap exists when multiple healthcare institutions provide care for the same patient. Substantial evidence suggests that more effective communication will improve patient care and reduce medical error, such as adverse drug events. Beyond the clinical improvements, there are also major financial benefits to be had. Interoperability is the ability to disparate computer systems to exchange information in a manner that allows the information to be used meaningfully. The desired result of interoperable system and electronic health record is to readily provide all health practitioners in all locations, including the pharmacy, with access to information about a patient's care as needed. The future, informatics in the healthcare system. Vision of healthcare is becoming more patient-centered. Healthcare is transitioning from industrial age medicine, which places focus on professional care and is segmented and also highly expensive, to a new approach alternatively described as the information age healthcare, which encourages lower cost individual care, getting friends and family involved, and using self-help network as first-line approaches. The transformation has been given the label participatory care, in that the new approach involves patients as highly active, decision-making members of their own care team. ETH 2.0, being the utilization of healthcare-related tools provided by Web 2.0, is the web-oriented extension of this new participatory care approach. Web 2.0 simply refers to those applications of the internet that are interactive and social, allowing for collaboration and interactivity among patients. Facebook is probably the most prominent example of Web 2.0. Facebook, as is well known, is a social networking portal that allows users to interact and share pictures, videos, and links, among other things. Patients like me, being a 2.0 social networking portal, is similar to Facebook, except that it focuses on allowing people with the same medical condition to communicate with each other about health-related issues. Other Web 2.0 and Ed 2.0 resources include blogs, wiki sites, Twitter, and personal health record. With a blog, anyone can post his or her thoughts on literally any topic at a particular site on the internet as a blog entry. Readers can then leave related comments directly below the published material. Conclusion. Pharmacy informatics is the scientific discipline found at the intersection of people, data, technology system. It is governed by business, technical, and regulatory standards to ensure optimal use of patient-specific and knowledge-based information. Healthcare providers rely on informatics to support their activities associated their daily activities associated with the medication use process. With effort towards electronic health record, healthcare providers will continue to see a growing role of informatics in their practice, regardless of the setting. Thank you.